I often say, Dr. Moore, that I think this problem would be super easy if everybody showed up to your office with a big, red, swollen, painful breast.
Yeah. Yeah. That would be so much easier. That would make
Right.
my life easier too, because I'm negotiating, like, honestly, with women who they've got them put in for a reason. They wanted them put in for a reason, right? They don't want to necessarily remove them, most of the people I'm talking to. And so you've got to just be really careful with, it's a big deal and it's expensive to have them removed. So when I'm talking to women, I'm just like, hey, like, we'll put this on the list. We're going to look at, is that a realistic thing that we have to do to get well? And sometimes, and I'll just give a story. I had a woman, we worked together for 4, 5, 6 months. We saw some improvements, but we just hit a rock wall. We could not get past. We couldn't get past it. And there were a few symptoms that were just continually getting worse. And it was symptoms of MS. Like, there was development of progression of autoimmune conditions. We saw demyelinization of neurons that were continuing, while a lot of other things that we were working on were getting better, like in the gut and different places that we could work. But I could not shut down this autoimmune path, which I have seen successfully reduce hundreds of times. And I just said, look, I don't know what else to tell you. Your mold tests are negative. Your Lyme tests now are negative. Your SIBO and your strep and your staph and your everything is negative. You've done all the work, but there's one thing that you haven't done. And I mean, she was crying on the call. Like, I felt for her. She did not want to take them out. She identified with herself with them in. And, it's a tough conversation. She did get them out. She called me about 2 months after they came out so we could get back going. And those symptoms were 80% better. The MS symptoms had regressed by about 80%. And I mean, she had tried everything before that. And I was just like, whew. It makes me feel a lot better when it's successful, by the way, Doc. Like, when they go in and they do that and then they get a win, I'm like, whew, all right.
Well, let's talk about the larger thing that we're not really, you highlighted the concern, right?